It's my pleasure to be here this afternoon, and our Senior Permanent Secretary, our Deputy Chief Medical Officer, Public Health, our Executive Director of the Public Health Agency, Senior Minister of Health officials, my able brother, Gobia, Sierra Leone, and UNICEF representative, members of the High Table, members of the Fourth Estate, on whom we stand here today to make sure that you take our message far and wide, both the print and electronic media. Once more, it's a pleasure to me to be here this afternoon, and I bring you greetings from His Excellency the President, who has unwavering support of human capital development, including health. And I bring you greetings from the leadership of the Minister of Health. And indeed, it's a special privilege to be with you this afternoon. As we all know, much has been said about the polio outbreak in March this year. And it just happened a few months after we have launched our National Public Health Agency. I think that was our first test to action. And so on that field today, where we are called to action, some of us had bought tickets to travel out of this country on holidays, on other engagements, but I think we cancelled everything and worked round the clock to make sure that we have the necessary pillars activated. And I must again thank the leadership of the Public Health Agency, Professor Fulisa, Dr. Vandi, and all our development partners, including the WHO and Tom, sitting there quietly, who's can be very active and stand his ground with UNICEF and everybody else. I think we all rally around this country to make sure that we do the needful for the children of this country. And it was indeed a great privilege for most of us to serve in that capacity. The detection of that virus in March this year was a national call to action, a regional call to action, and a global call to action. And we did the needful in making sure that we initiated all the pillars, and then we had all the public health messages out there, and then came the issue of the vaccines. That was a sticking point. We thought we had supplies, and but at the end of the day, with no blame games, we will be able to come on top of situation today to be able to launch so many rounds. And we see in Sierra Leone, we always go for the best, we don't settle for the rest. And we have been the Athens of West Africa. So whatever we do, we have a legacy to build upon. So I'm very happy that we're able to succeed in getting the vaccines committed to ensure that no child in Sierra Leone is left vulnerable to polio. As we know, the Minister of Health, ambitious as we are, we have a special response to healthcare delivery system, the life stage model, which means from conception to senior citizenship. We look at all factors and address all factors that affect the patient along that line. So for our beloved children in this country, I think we owe them that responsibility to make sure that indeed we address all factors, including infectious diseases, non-communicable diseases, etc. So polio was not an exception, that we rose up to the challenge to make sure that as a custodian of the health of this country, we were charged with the responsibility to do the needful. Therefore, we were able to actually mount that response to the polio outbreak, and today we are happy to see that we are launching this round, as has been detailed by the Executive Director and all members of the High Table. The campaign is not only about polio. It is to ensure that the future generation of our country is well protected. Children are the future leaders of today. And we used to say future leaders of tomorrow, but no, they are the future leaders of today. They have to be protected very well. And so we are going to do everything possible to make sure that the children of this country are protected against all immunizable diseases. And I speak now, we are looking at new technologies to make sure that we monitor the vaccination of children across the country. As I speak, a great international team is already landing in this country with a new app developed by us Africans from Uganda, thank God to the country, to make sure that we monitor the vaccination rates of children across the country digitally. We are going digital in this country. And so it's not only about polio, it's about all immunizable diseases in this country. And I want to express my heartfelt thanks and appreciation to all those who have helped us along the way, the political leadership of this country, the technical leadership of the country and the ministry as well as all our development partners for rising up to the occasion to make sure that we protect our children in this country. There are too numerous to name, but I think we have most of them seated here, the WHO, the UNICEF, and all our development partners. You have done an incredible job for us to be here today to make sure that we launch this particular round of vaccination. And this campaign is a testament to what can be achieved through active collaboration. As we normally say, we believe in teamwork in Sierra Leone. Much to the African proverb, if you want to go fast, you go alone. But since you want to go far, we are always going as a team. And so teamwork is very essential to all of us. And in that regard, we ask everybody to help us in this campaign of vaccination to make sure that all the children are vaccinated. We ask the parents, the opinion leaders, the faith-based organizations, and everybody in the community to make sure that we achieve this goal together as a team. And we are very determined to make sure that we achieve this. As I said, getting these vaccines was an Herculean task. We thank the leadership of this country, we thank the development partners, especially the WHO. Some of them have to sit in conferences to actually talk to the international community so that let us allow polio to affect our future leaders of tomorrow. Of today, it's a very deadly disease that can cause paralysis and even death in most of the muscles of the body. So we thank everybody today, and especially the fourth estate, at several conferences, press conferences were held in this particular room where the outbreak occurred, and we thank you for dissemination our information, our vision for this country. And in conclusion, I urge every parent, guardian to take advantage of this opportunity to protect our children and protect our future. And thank you all.